こんにちは。オレゴンで、合法なシロシビンセッションを行っている、ドクターイアンと、ビショップナオコと言います。今回は私たちが日本語でセッションをグループセッションを行うために、いろいろなプログラムを用意していることをご紹介したいと思って、動画を作っています。それではドクターイアンにちょっと自己紹介をしていただきたいと思います。Could you introduce yourself?
Konnichiwa. My name is Dr. Ian Luepker, and I'm a physician licensed here in Oregon, Ashland, Oregon, and I'm a psilocybin facilitator, and I run a ketamine-assisted psychotherapy practice as well. I've been a physician for 24 years, working a lot on psychiatric units, and now we're offering psilocybin group sessions focusing on depression, anxiety, trauma, and existential distress at the end of life.
日本人の方向けに、サイケデリックセラピーがどんなものなのかドクターイアンに教えてもらいたいと思います。So Dr. Ian, what is a psychedelic therapy?
Yeah, so psychedelic therapy is a fairly new, yet at the same time ancient approach to healing. It's using these very special sacred medicines to really look deeply at what is suffering and how can suffering be alleviated and overcome.
And thank you. And then how does it work as a form of treatment?
Yeah. So when people are seeking psychedelic therapy, it needs to be held in a very safe environment. We do a lot of preparation work to really explore what is the intention, what are people wanting to heal, what are they wanting to understand and explore within themselves. We do preparation, and then we spend time during what's called the administration session, where the medicine is given, and people go deeply within themselves, deep into the heart, and really explore what is it that's holding them back from being free and fully healed. And with this information, from this perspective, looking deeply inward, they're able to find information and guidance from their own innate healing capacity that allows them to deeply heal and move forward in life, find meaning and purpose and a deeper understanding of why the sadness, why the anxiety, how can they heal the trauma, and some other deep questions that it's difficult to address with a lot of conventional medicine approaches.
And what kind of medicines do you use?
Yeah, so I'm using both ketamine-assisted psychotherapy, and ketamine has been around since 1963. It's very safe, it's very effective. It's on the World Health Organization list for essential medicines based on safety and efficacy. And I'm also offering psilocybin-assisted therapeutic sessions, both with individuals and with groups, where we're doing it within a medical context. It's very safe. We really check to make sure there's no issues that would prevent a safe usage of this medicine. And those tend to be a little bit longer, typically 4 to 6 hours. Ketamine is a little bit of a shorter experience, 45 minutes to an hour, but both are really effective medicines for treating depression, treating anxiety, addressing what stresses people may have going on in their lives, and approaching and treating existential distress, fears around the end of life and mortality. It's very effective for people who are facing a life-limiting illness, like a stage 4 cancer or heart disease. People who are at the end of life, it's very helpful.
Thank you. And then what is the difference from traditional psychology or traditional pharmaceutical medicine?
Yeah. So most traditional pharmacological treatment involves suppressing symptoms. So if you have depression, you're given an antidepressant. If you have anxiety, you're giving an anti-anxiety medication. And these don't cure the depression or anxiety. They might suppress them and push them down for a few hours if we're talking about an anti-anxiety medication like Klonopin or clonazepam. Or with antidepressants, also it may suppress the depressed feelings, but it also can suppress and mute good feelings that you might be having, joy or happiness as well. So this is a very different approach to medicine. With psilocybin and ketamine, we're able actually, in a more holistic way, to look at why the depressed part, why the anxious part, how can I work with trauma, and taking a different perspective on those three issues, we're able to have some insight into what are the root causes and how can we change our lives to address really what's underlying the depression, what's underlying the anxiety, and how can I address the trauma as well.
Thank you so much.
You're so welcome.
Yeah.
Thank you.